friends, today we are going to learn about some of the common terminologies which are used for dental caries in operative dentistry. Primary caries. Primary means first ever. The first attack of caries on a tooth is known as primary caries. We can also say in this condition, caries lesion develops on an intact natural tooth surface or caries lesion on previously sound tooth surface. That means the tooth should be sound. We can also say it is the first ever encounter of the tooth to caries lesion. Secondary caries. As you can see the name, it is secondary or second attack. We can say the subsequent attack of caries on a tooth that has already been restored. So, as we learnt in primary caries, it was the first ever encounter of tooth to the caries. But here, the tooth have already been encountered with the caries lesion, and now it is again attacked by the caries. Secondary caries is usually seen at the junction between the tooth and the restoration or develops next to an existing restoration. As we have seen in old restorations, caries develop beneath the restoration or on the edges or sides of the restoration. That is secondary caries. It is also known as recurrent caries. Incipient caries. Incipient caries represents the early carious lesion which is in initial stages. Unlike primary, in primary caries lesion, that was the first ever attack of tooth with caries lesion. But here in incipient caries, it is the early stage, initial stage of any caries lesion. The first ever changes which are happening in the tooth surface. It is identified soon. It can be resolved by use of remineralizing agents. Hence, it is also called reversible caries because it can be reverted back by using remineralizing agents. Cavitated caries. This represents the carious lesion that has cavitated the enamel and progressed into dentine. In this case, remineralization is not possible and restoration is definitely needed. This condition is also known as irreversible caries because it cannot be reverted back. Pit and fissure caries. This is the carious lesion involving the pit and fissures of the tooth. Here caries occur because of the imperfect union of the developmental enamel lobes, and pit and fissure are the most common sites for caries as they are potential sites for food entrapment. Wherever food is lodged and is not removed during brushing or the tooth surface is not clean, then it will cause caries. So here the structure of pit and fissures is culprit because it entraps the food particles in it. Forward caries, as the name suggests, it is moving forward. This is the term that is used to describe a carious lesion when the caries cone in enamel is larger or of the same size as the caries cone in dentine. You can see in the diagram here in enamel or here in dentine. In both the structures, the shape and the size of the cone is almost similar or little bit larger in size in enamel. Backward caries. When the spread of the caries along the dentino-enamel junction exceeds the caries in the contiguous enamel, caries extends backward into this enamel from the junction. Means it starts growing backward. The spread of caries in dentine is faster as compared to enamel. Once the caries reaches the dentine, it starts growing rapidly in lateral directions also, and from there it starts involving the enamel from backside, from dentine side. So that's why it is looking like it is going backward. So it is known as backward caries. You can see the same in the diagram. Acute caries. This refers to the caries which is of rapid onset and progress. The lesions in acute caries are light yellow in color, soft in texture and highly infectious. It affects large number of teeth, and the patient having acute caries shows the symptoms like sensitive teeth and pulp is exposed. Chronic caries. Chronic caries refers to caries which is of slower onset and spread. Here the lesions are hard in consistency and dark brown to black in color. The most common location for chronic caries is edges of restoration and fracture places. These occur in lesser number of teeth and it is not as vast as acute caries, and chronic caries are long-standing caries. Pain is not common feature in chronic caries. Pain may or may not occur. Residual caries. The name residual suggests it refers to the caries that is left over in a completed tooth preparation either by operator's neglect or intentionally. Caries that is left behind because of the operator's negligence, especially in the enamel or near the dentino-enamel junction, is unacceptable. However, caries may be intentionally left behind when it is very close to the pulp while performing indirect pulp capping. So sometimes it is required to leave a small amount of caries because it is very near to the pulp. Residual caries can be categorized into two. One accidental and second one is intentional residual caries. See in the diagram here, it is accidental caries which is left behind due to the negligence of operator. This is the residual caries which is left intentionally by the operator to prevent the pulp from exposure. Smooth surface caries. This represents caries involving the smooth surface of the tooth. Those surfaces of the tooth which are covered by plaque for prolonged period of time are more prone to this type of caries. These include the proximal surface of teeth and the gingival 1/3 of the facial and lingual surfaces of the teeth, as you can see the same in the diagram. Root surface caries. This is the caries that is seen on exposed root surface following gingival recession. Since it is generally seen in elderly patients, old patients, it is called senile caries, and root surface caries spreads more rapidly when compared to caries on other surfaces, and therefore it has to be treated soon after detection. This type of caries is rapid in progression and it is very close to pulp also, and this type of caries is difficult to restore. Thank you for watching my video. Friends, if you like my video, please subscribe my channel and ring the bell icon for latest updates.